It's Tyler with TJX Survival and Survival Dispatch. Let's talk about how to build a custom at-home trauma kit. Stick with me. So I wanted to call this the Mostly Peaceful Protest Trauma Kit Basics, but I can't do that. So we're just going to call it how to build a trauma kit. The problem with a lot of the trauma kits is people want a kit for everything. That's called an emergency room. And I like that, it's a great idea, but it's just not realistic. It's not pragmatic, it's not practical. When it comes to building a trauma kit, they need to be purpose built, and they need to be built for the vehicle, which means the highest probability of accidents are going to be vehicle accidents, fires, whiplash, stabilization, that kind of thing. Or they need to be built for a hunting backpack or a bug out backpack. That's going to look like a military IFAK kit. That's going to be bleeding, stopping, bullet, packing, sucking chest wound, tourniquet, those kind of things. Or they need to be what I call the family kit. The family kit has burn prevention. It has a ton of band-aids. It's got big knee SpongeBob band-aids that'll handle a lot of bleeding. It's got Neosporin, it's got medications, those kind of things. Or it could even be the long-term kit. The long-term kit is going to have some kind of medicines. It's going to have sutures. It's going to have, I can't go to the emergency room equipment as available. And that's also going to have a lot more of a steep learning curve. So let's talk about this kit. This is an adapted MyMedic kit that I have done things to. Okay, I've added stuff to, I haven't really taken anything away. But let's start from the beginning. There's a bunch of different methodologies, TCCC, EMT training, a bunch of different stuff that I've done and other people have done over the years. There's, I'm going to call it the emergency room hospital approach. There's the first responder in the forest approach. There's the EMT approach, and they all are kind of targeted towards medication stabilization care. They're targeted towards stabilize and transport in the mountains, or they're targeted towards stabilize for big duration because you might not be able to transport. So it kind of depends on the situation. So with that in mind, whatever kit you're going to make them purpose built. If you want to have an overall or all around kit, an A-bag, if you will, or a field hospital, it's going to look something like this. Every kit has to start out with BSI, body substance isolation. Now, unless you're a soldier working on another soldier that you know has been tested for AIDS, syphilis, gonorrhea, whatever type of diseases that they shouldn't have, unless you're a soldier that has been tested for that, you need to be wearing gloves. A lot of times you need to be wearing a mask, you need to be wearing an eye shield. If any kind of human particulate spatter can get into a cut in your hands, in your mouth, in your eyes, you're going to contract whatever diseases we dirty people are carrying. Whatever you have, make sure the first thing accessible is the body substance isolation or the stop the bleed kit. Those are, whatever kit you've got, I believe that needs to be right on top. As an example, I have right on top a tourniquet. It's already preset so that I can pop it out, throw it on, and start cranking on it. And I have it attached right here with the Velcro so that, you know, it's all ready to go. That way I can just pop it out and it's not going to fall out if something gets bumped. There are ways to stage your tourniquet in a way that you can just stick it straight to the Velcro, which is how I have it in my EDC bags and my Bob bags. If you're worried about a mass casualty event, I mean, 2024 is coming up. Let's pray that doesn't happen, but if it does, and if you are worried about a mass casualty event, 4 tourniquets per human, if we're being honest. A major explosion, you got 4 limbs that you can tourniquet, you need 4 tourniquets per human. If you've got 5 people in your family, you need 5 times 4 tourniquets for your kit. Keep that in mind. 1 is a minimum, 1 is a start. I have more tourniquets on the inside. The reality is if I need one, I need it right now. I can tourniquet right now, then I can worry about body substance isolation. So we start opening up this bag. There's a couple of different layers. Partition your bag, right? The IFAK, the military IFAK, is going to have tourniquets on the outside, and then it's going to have maybe one more tourniquet on the inside. It's going to have gauze or wound packing for bullets. It's going to have Vaseline patches for sucking chest wounds. It's going to have some needles so you can decompress the trach once, if you have a collapsed lung. It has all of these bullet stopping and stabilizing things, and it's a pack about this big. Wear it on your body armor, but it is just bullet and shrapnel and hole poked in my big jelly body prevention kit. If you want to take it past that, then you've got the Medic A bag. You have medications, morphine, you have blood clotting agent, those type of things. But all of these are focused towards stopping the bleed if someone gets a hole poked them with the high velocity dinosaur turd, right? So we want to work on purpose-built kits. Moving away from the IFAK and back to this is going to be more of a family kit and less of like an ENT type kit. So because it is a family kit right here on top, again, there's another tourniquet. Here is a couple of EpiPens. These are a nice thing to have. Legally, you have to be prescribed your EpiPen. This is my EpiPen. I don't really need an EpiPen, but I have one. If I ever have an anaphylactic related problem from something, I can deal with it. If somebody else has an anaphylactic related problem, maybe you don't know you're allergic to bee stings until the first time you get stung and you don't want to die. Well, here's an EpiPen to prevent that. This is the next level down, right? The upper level being body substance isolation, stop the bleed, tourniquets, wound packing, that type of thing. And then the next level being, I'm going to die if I don't have this right now, EpiPen, those type of things. As we start to get a little bit deeper, the gloves I talked about a minute ago, there's some in each level because you can just throw them on top. There's a bunch here, there's more here, more here. I've got them all over the place. We start getting into tools. Tools can be buried in your bag because you don't need them right now, right? So one tool that I have that I use more often than I like to admit is this triangular shaped stabby device, and it is for removing slivers. This isn't something that I need to be quickly accessible or on top because I'm not gonna die even if I go a couple days without removing a sliver. The way that it works is this triangle shaped needle basically will slide in the sliver hole and split the hole open so you can use another tool or your fingers or whatever to get that sliver out. But it's something that's really valuable to me, and I've used this more than I have the majority of the rest of the stuff in the kit. There are tweezers to help remove those slivers. There is little fly fishing grabby doobie grabbers, right? Make the jokes. And then this is another tool that is used for removing particulates from someone's eye, and it's basically a plastic fishing line. So if I look in this direction and I scrape it out that direction from the corner of my eye, I can grab the rock or the pebble or particulate that's in my eye and I can slide it out. Or I can do this with someone else, right? So these kind of deeper tools are nice to have. I wouldn't put something like this in an IFAK. I don't know that I would put it in a kit that isn't like the big family kit. Up front we've got clothing removal tools. If you've got a burn or something and you need to find other wounds, if you're in a car accident, you need to search for other wounds, you're going to cut clothes off and look for holes in people. Same thing with shrapnel, bullets, that kind of thing. There's masks. Masks, controversial, they shouldn't be. The reason these masks are here is to keep stuff from getting into my face splattered and keep me from spitting into a wound. There's saline solution, other tourniquet types. These are devices to check if the eyes are equal, round, and reactive. We're starting to move into EMT, blood clotting agent, that kind of stuff. There is also ice devices, right? You want these for two reasons. If you have a sprained ankle and it's hot, you want to ice and elevate. So you crush this and shake it, and it works kind of like a snap chemolite to make that limb cold. If you have a burn, you want to immediately make it cold. And I have some kits in here that also help with burn prevention. SAM splints. SAM splints are great for broken arms and legs. Basically, they are a splint that opens, and then you fold it like this, and it becomes rigid. It won't bend. So it's kind of like an instant cast of some sort. And you can crack it like that, mold it to the arm shape, put it in a sling, and now you've got a way to hold the limb until you get to wherever you're going to go. Yes, you can stabilize with sticks and whatever, but this is a little more hygienic, a little less painful. Okay, we talked a little bit about burns. They got some burn shield here, different medication, gauzes, things that we need a little bit quicker. I need to do better on labeling, because if you haven't looked in this for a while, it takes a second to remember what you've got and where it's at. These are medications. Again, they're a little bit deeper into the kit because it's not something I need right this second, like tourniquets, body substance isolation, burn prevention, or burn healing devices. Some burn shield. Basically, this is hydrogel that you put directly on the burn. So if you get, I don't know, you're cooking soup and something splashes, you get some sort of fire, you're gonna put this on your face. I have another kit that's for the whole face. This would be for something smaller, and it immediately cools the wound. And if you immediately cool it, you immediately stop the destructive forces of the burn, and you will have a quicker recovery from that burn by using something like Burn Free or whatever name brand you want. I don't care as long as it works. Another thing for quick access, I like to show you guys. I have scissors right on the outside. Sometimes assessing the situations, like the quickest thing that needs to happen so you can stop the bleeding. We're basically a sack with this tree branch of blood on the inside, and when we poke holes in it, we die. So the faster you can find the holes and plug them up, the faster you can keep all the blood in this sack, right? Okay, we've dug a little bit deeper into the kit now. There are more medications, clotting agents, some old Israeli bandages. Again, more gloves. I have gloves in every compartment. That's a good little takeaway. And because this is a little bit deeper, I'm going to have stuff that I don't necessarily need right this second, like moleskin. Moleskin is something that you're going to put on a blister when you've been hiking big distances. It's not something you need immediately. Some of these other kits are for broken fingers, not necessarily life-threatening or stuff that I need right this second. And something a little bit more high volume is gauze. You need some gauze quick access, but you also don't need your whole front pocket to be tons of gauze. So put gauze a little deeper. Like I've got packets of gauze right here inside of the kit. The Burn Free mask that I'm talking about. I love this brand. I'm not sponsored. I don't care what brand you buy, but I like Burn Free. It works really good. They've got spray that will stop sunburns dead in its tracks, and it will help you repair faster. This big kit is to be ripped open and put on someone's face, right? So if you get blasted, a fire blows up or something hits you in the face, first off, hold your breath. Don't breathe in the flame and roll until that fire's out before you breathe. You'll suck flame into your lungs and destroy the bronchioles and you'll die. That sucks. So have Burn Free available, something that can cover your entire face and your entire arms. A lot of times you'll burn on the outside of the clothing. Have that type of kit accessible. Some more Burn Free, and then trauma dressing. In the depths of this bag are hydration related problems. So sometimes you can have heat stroke and be in the sun so much that you've sweat all your salt out. So the water doesn't necessarily correct the salinity of the battery, so to speak. And when that happens, you grab water with different types of Gatorade type materials or liquid IV type materials. And again, those are in the depths of the bag because I don't need them right this second. It's a couple more SAM splints. This is a very large kit. Maybe I get in a car accident, 3 people have a broken arm, I can deal with 3 people with those SAM splints. This is super glue and metastripes. Basically, if you get ripped open, it's a way to hold it together and super glue it until you can get back. Now, if you're super gluing something, especially if it's really ripped open, you need to clean it with saline solution, or you need to take it to the hospital, reopen and clean it with saline solution. Otherwise, you're introducing an infection in there. It's always good to have some sort of antibiotic on hand. I have a pile of antibiotics over there that are just sitting for an unfortunate situation like that. So make sure that if you do deal with some sort of wound that got opened, clean it, seal it, antibiotics until it heals so that you don't accidentally introduce infections. Got more saline in here. Just talking a little bit about cleaning. You want to rinse the wounds with saline solution, and tons of gauze. Gauze is used to pack cavities. If I get a bullet in my guts, right, I'm going to grab gauze and I'm going to fill and load up every single little hole I can find until I can no longer pack it, and then I'm going to put something on the top of that and I'm going to ship to the emergency room. So you need a lot of gauze to fill a lot of holes. If you have a hole here, but the vein has pulled itself up here, you got to push gauze in until you push it against that so that you can stop the bleeding until you can transport to surgery. So that's why you need a big grundle of gauze for those solutions. Here's more gauze rolls and more gauze. All right, so hopefully this is valuable to you. The basic takeaways are this: body substance isolation, tourniquets on the outside, bullet prevention stuff needs to be a little more quickly accessible. Medicines that stop death need to be quickly accessible, like an EpiPen. As you get deeper into the bag, you can get into more unorthodox things like a tuning fork to see if the bone's broken, that little triangular stabber to get the splinters out of your hands, rehydration type of kits. So structure your bag in a way that goes from I need this now or I die to I can wait a little bit a while before I get this to this is the least important thing, probably that rehydration. Hydration is very important, but it's probably the least important thing. I can get to it when I get to it. People aren't going to suddenly die if I don't have a drink in the next 5 minutes. Once you've structured your kit like that, you should be good to go. Now, if you're going to structure your kit for a vehicle, neck brace, stabilization type of things, right? Stabilize and transport. If you're going to structure it for the backcountry, weight is a major issue. You're going to want to have stuff that's small. You're going to want to add something that you know you use. You can have too many Band-Aids, but you don't really have too many aspirin, ibuprofen, Benadryl, Neosporin, those type of things. Carry what you need, don't carry what you don't. And then that family kit being something like this, load it all the way up. Make sure you've got body substance isolation tools in every pocket. Maybe that's a gas mask and a chem suit. Maybe it's just rubber gloves or anything in between. Then lastly, have multitudes. You don't need an A bag like this in every one of your vehicles. That's just way too much money. But it would be good to have one A bag in your primary vehicle, maybe an IFAC in your bug out bag, and something big in a pharmacy at a home. So purposely come up with what is the problem, then create the bag that is the solution. Don't go out and buy pre-made stuff. I mean, My Medic makes some great stuff. I support them. They're not my sponsor. But for the most part, when you get these pre-made things, it's a bunch of Band-Aids and no tourniquets, no gloves, none of the stuff that you actually need. Okay, hopefully this is valuable to you. Leave your comments down below, and thank you for watching.